Hi, everyone. My name is Dr. Kristen Lindgren, and this week, as promised, we will be discussing testosterone replacement therapy. If that sounds interesting to you, then grab a pair of headphones and let's go. It's 6:30 a.m., Mr. Smith. Time to wake up. Your alarm has been blaring for a solid 2 minutes because apparently you can sleep through a hurricane now. You drag yourself out of bed. Well, technically, you roll over, grunt, and then fall out of bed. Your knees pop, your back cracks, kind of like the sleep you'd expect to get from a concrete mixer. You shuffle to the bathroom, trying to get all of your joints back in place. There's the usual moment of shock as you catch a glimpse of yourself without a shirt on in the mirror. Who is that guy? Your hair thinner, your waistline thicker, and then there's the man boobs. You suck in your gut like a champ. Try to flex your pecs. Nope. Still soft. Just look away and get in the shower. Your back pain definitely needs a shower. Downstairs, you're greeted by the kids fighting over cereal and your partner asking why you left your socks in the fridge again. Classic dad brain. Everyone laughs. Funny. Except you're starting to think that they may have a point. You forgot to take the trash out again, left your keys on the roof of your car again, and that big work presentation you were supposed to give today, you completely forgot to prep for. Panic sets in. You used to be able to pull those completely out of your rear end without even thinking about it. Now you have this strange new anxiety about public speaking, about all sorts of things actually, now that you think about it. Shouldn't you be more confident about things you've been doing for decades and not less? You grab your coffee and sit down. You used to hate coffee. Kind of still do. But without 2 or 3 cups, your eyes won't even open all the way. Where's your energy, your drive, your mojo? Even the dog looks more motivated than you do. You scan the kitchen and living room and see the missing doorknob on the pantry, the 3 canned lights in the ceiling that still need replacing. That stuff used to drive you crazy. Stuff you would have taken care of yesterday. Now they're just reminders of your total inability to give a fuck. Later, at the gym, your workout is a bit lackluster. The weights that used to be warm-ups now feel like they're filled with cement. You're huffing and puffing through 3 reps when you notice that the 70-year-old guy just going to town over there on the elliptical next to you is giving you a pity look. He asks if you need a spotter. That's just great. Back home, you're sitting on the couch after dinner, completely exhausted. The kids want to play. Your partner's giving you that look, using the Jedi mind force to communicate laundry, lunchboxes, and bedtime stories don't magically do themselves. And all you can think is, please, dear God, just let me watch one episode of Shark Tank before I pass out. By 8:15, you're out cold, snoring like a bear. And the kicker? You don't even know what's wrong. You're just tired all the time. Your muscles aren't there like they used to be. You're kind of getting fat. The brain fog is severe. Anxious about everything. And let's not even talk about what's going on or not going on in your bedroom. You used to be a baller. No one is accusing you of that now. You're not even sure what to call this tragic situation. If any of this sounds familiar, welcome to a little story I call I'd Bet Any Money Your Testosterone Has Finally and Officially Tanked. It's not your fault, and you're not alone. Low testosterone is a common issue that eventually sneaks up on most men, zapping their energy, strength, and confidence. For a whole host of reasons, testosterone levels in men are declining faster and earlier now than ever before in recorded history. But don't worry, there's hope, and we're going to fix it. Let's get into it. The Man Manual, tuning up testosterone for peak, or even just back to regular, performance. What does testosterone do for men? Well, basically everything. Testosterone is the star quarterback of male hormones. It's what helps men build strength, stay energized, and feel like, well, men. But testosterone isn't just about muscles and machismo. This powerhouse hormone plays a role in almost every system in the body. 1. Libido and sexual health. the no-brainers. Testosterone is the driving force behind your libido. It keeps libido healthy and plays a key role in erectile function. Low testosterone can kill your sex drive. Remember when all you ever thought about was sex? That was normal. And it's not just about sex, though. Testosterone supports healthy sperm production and fertility. It helps maintain critical blood flow to erectile tissue, allowing you to both obtain and maintain erections. 2. Muscle mass and strength. Other no-brainers, I know. If you want to maintain those biceps and keep the love handles under control, testosterone is your guy. It promotes protein synthesis, which is crucial for building and repairing muscle tissue. Without it, you'll notice a loss of muscle mass and a slow but steady increase in body fat, especially around the midsection. 3. Energy and stamina. Feeling like you've hit the wall at 3 p.m.? Testosterone plays a huge role in energy metabolism. It helps keep you fueled for life's demands, whether that's chasing the kids, crushing it at work, or dominating your pickup basketball league. Low testosterone can leave you dragging through the day like you've been running on fumes. 4. Mood and mental clarity. Testosterone doesn't just pump up your muscles, it also lifts your mood. Healthy testosterone levels are linked to emotional stability, mental sharpness, and reduced risk of depression. If you've been feeling foggy, irritable, or just plain off, low testosterone might be to blame. 5. Bone density and cardiovascular health. Most people associate testosterone with strength, but its benefits go deeper, literally. Testosterone supports bone density, reducing the risk of fractures and osteoporosis as you age. It also helps maintain a healthy cardiovascular system by keeping your blood vessels elastic and reducing inflammation. 6. Healthy fat distribution. Testosterone helps regulate where fat is stored in your body. When levels are optimal, fat tends to stay in check. But when testosterone is low, fat storage increases, especially in the abdomen, contributing to the dreaded dad bod. 7. Confidence and drive. Ever wonder where that inner spark of ambition comes from? Testosterone is a big part of it. Healthy levels drive motivation, competitiveness, and a sense of confidence. It's the hormone that says, yes, I can fix the car, beat my personal record, and crush that work presentation. When testosterone levels drop, it's like pulling the plug on a finely tuned engine. Energy fades, strength dwindles, and motivation becomes a distant memory. But here's the good news. With the right strategies, including testosterone replacement therapy and lifestyle adjustments, you can reclaim your edge and get back to feeling like yourself again. Symptoms of low testosterone: loss of muscle mass, poor concentration, decreased motivation, depression, anxiety, irritability, increased body fat, hot flashes, sleep disruption, fatigue, loss of libido, erectile dysfunction. Longer recovery times from workouts, longer recovery times from injuries. Look at that. Look at that. I'm like glowing like an angel. Hang on, let me fix the light. Everyone knows I'm not that. Okay, where were we? That might sound like the kitchen sink of symptoms experienced by guys, and that's because it is. Remember, testosterone has its tentacles in every organ system of the body. What causes low T? Crappy diet, ultra-processed foods, sugar or fake sugar in everything, ingredients you can't pronounce, crappy environment, plastics, pesticides, phthalates, crappy lifestyle, smoking, too much alcohol, marijuana, opiates, not enough exercise, crappy job, too much stress, too many kids, too many commitments. Cortisol blocks testosterone's effects. Just getting older, which of course is preferable to the alternative, I realize. Fix the light again. I'm fixing the light again. I'm sorry, people. It's not a professional studio, people. Sorry. How do I know if I have low T? Labs, my friend. Just get your labs. Which labs, you ask? Well, here you go. Total testosterone, free testosterone, sex hormone binding globulin, or SHBG, Estradiol, CBC or complete blood count, CMP, comprehensive metabolic panel, PSA. If you're feeling like shit, you should have more checked than this, like inflammatory markers, hemoglobin A1C, fasting insulin, vitamin levels, cortisol, thyroid studies, DHEA, IGF-1, homocysteine, and ferritin. You're not just a testicle. Your entire endocrine system works together. But if we're sticking to just testosterone here, the bulleted labs above are the essentials. What is a normal testosterone level? A loaded question. This is where we can get lost in the weeds. I refer to as, quote, the fallacy of the normal reference range, end quote. A bit of a semantic argument, but one well worth making, in my opinion, an argument I have written about ad nauseum. What does normal mean when we're talking about lab values? The normal reference range is a number determined by the lab. It isn't determined by hormone experts who've done studies on what level of hormones are associated with what degree of health and wellness. It's an almost entirely arbitrary range determined by running a statistical analysis on the results of the labs of the people who went there. So when we're talking about testosterone, for example, the lab takes all the testosterone levels it measured from all the guys that went there, threw it into a computer, ran a statistical analysis, and gave us a range. Who's in that reference range? Every adult male. It doesn't matter if they were 18 or 80, sick or healthy, on TRT or off. Everyone gets thrown into the mix, and voila, we have our reference range. That's why we get ranges that look like this. LabCorp, normal total testosterone range, 264 to 916 nanograms per deciliter. And this, Quest, normal total testosterone range, 250 to 1,100 nanograms per deciliter. And this, Access Labs, normal total testosterone range, 241 to 827 nanograms per deciliter. And if you believe Quest, are you then to believe that if your testosterone is 249, it's too low, but if it's 251, it's just fine? What if I then told you your testosterone rises and falls throughout the day, every day? This normal situation just gets muddier and muddier. Suffice it to say that no man with a total testosterone less than 400 feels like a man anymore. Complicating things further, testosterone is a hormone that exists in three forms in your body. First, it can be cruising around in the bloodstream all by itself. We call this free testosterone. Next, it can be bound tightly to a protein carrier molecule called SHBG, or sex hormone binding globulin. Testosterone bound to sex hormone binding globulin is a reserve tank for a special occasion. SHBG allows the body to regulate how much testosterone is accessible to the body at any given time. Lastly, testosterone can be bound loosely to a different carrier molecule called albumin. Albumin is like an Uber driver, taking testosterone where it needs to go and dropping it off. Total testosterone measures all of it: free testosterone, SHBG bound testosterone, and albumin bound testosterone. But your body can't use all of that testosterone. What's bound to SHBG is effectively locked away in a vault. Ideally, we'd like to know just the free testosterone and the testosterone bound loosely to albumin. These two groups of testosterone are referred to as bioavailable testosterone. That's the most meaningful number. Confused yet? Don't be. I say all of that to explain why it's so useful to get all of those numbers when having your labs done. We use them to calculate the bioavailable testosterone. I say it also to emphasize how important it is to work with a provider who knows what the hell these numbers even mean. Normal versus optimal testosterone levels. Look up the word normal. You will see that it is synonymous with average, run-of-the-mill, mediocre, or my personal favorite, unexceptional. If you're cool with your health being unexceptional or mediocre, you can stop reading here. Optimal testosterone levels are in a range synonymous with gangster, a level of health in men not seen yet in this century. In the US, we live in an environment totally polluted with chemicals referred to as neuroendocrine disruptors. Pesticides, herbicides, plastics, phthalates, PCBs, bisphenols, hormones in food, ultra processed food, soy, which is literally in everything, anything with a red dye, anything with a fragrance, all aluminum based antiperspirants. The list of these testosterone zapping chemicals is endless. Neuroendocrine disruptors make good on their name. They disrupt and destroy your endocrine system, the system responsible for regulating hormones. Neuroendocrine disruptors are also referred to as xenoestrogens because they so closely mimic the effects of estrogen. We now know that if you expose a male frog to enough of the herbicide atrazine, it doesn't just get low T, it turns into a girl, like an actual girl frog. In a study published a million years ago, 2010, 10% of the exposed genetic male frogs actually morphed into functional female frogs, then copulated, that means had sex with, you know this, right, with unexposed males and produced viable eggs. True story. Actually made eggs like the girl frogs. Crazy. When I asked the big brain model, ChatGPT, to draw me an AI version of that story, this is the graphic it gave me. Don't look for too long, it will give you nightmares. I'm sure you'll all be shocked to hear that atrazine remains, to this day, the second most commonly used pesticide in the US, right next to glyphosate, another neuroendocrine disruptor. Supplements to increase testosterone naturally. I was tempted to be snarky and just write, this page intentionally left blank, but I didn't. What I will say is that there's little to no scientific evidence that any herbal supplement will increase testosterone levels naturally in men. I have anecdotally seen some improvements in, quote, proprietary blends of supplements in some men, but that's extremely uncommon. Here's what you will see on the shelves at GNC, however. Tongkat Ali, Tribulus terrestris, aspartic acid, fenugreek, zinc. The only real caveat here is DHEA, which is actually not a supplement but a hormone. DHEA is an anabolic hormone made largely by the adrenal glands. In the pathway of hormone synthesis, we can see that if DHEA pops up and over through androstenediol, that it could make its way over to testosterone. Clinically, I don't see this happening much, but there are a ton of benefits related to DHEA supplementation. And even though DHEA is technically a hormone, it is available over the counter as a supplement here in the US. What about clomiphene or N-clomiphene? I wasn't sure where to put the invariable clomiphene or N-clomiphene question, so I guess I'll put it here. These medications are synthetic analogs of a hormone called LH, or luteinizing hormone. LH is the hormone that stimulates the testicles to make testosterone. In some younger men, taking these medications can increase natural testosterone production. I don't want to get too far into the weeds on this, but N-clomiphene is much preferred to clomiphene because of its half-life. Both are medications, however. Neither are indicated for this use, but sometimes are used off-label to treat low T. Testosterone replacement therapy, or TRT. The only real true blue way to increase testosterone levels is to take it. Hormone optimization should never be done in a vacuum. If you're not going to change your diet, improve your sleep, get some exercise, and reduce your stress, then taking testosterone isn't worth your time. Seriously. But if you're ready to make the necessary lifestyle interventions, I can guarantee you TRT will change your life. Options for TRT: topical, oral, nasal, buccal, that means like rubbing it on your gums or something, I guess, injectable, and pellet. After doing TRT for more than 10 years, I will tell you that topical and injectable testosterone replacement are the best and most cost-effective. I've never advocated for the use of commercially available testosterone formulations. They're garbage and they cost a mint. The strength is way too low, so to get enough, you end up using a ton, which invariably gets all over the dog and your wife. who then grows a beard. Whoever thought taking testosterone by mouth or rubbing it on your gums would be a good idea for your liver should be shot. That's not a call for violence. It's just some comedy. Our three-letter agencies have stated the new, shiny, expensive oral testosterone formulations are, quote, generally considered safe and seem to have, quote, limited risk for hepatotoxicity, which means melting of your liver. Never mind, every other known anabolic hormone on the planet causes liver liquefaction, but whatever. Testosterone pellets are infinitely convenient, but I've really moved away from using these. The list of reasons is long. It's not that they don't work or that they aren't safe. They're just painful, expensive, difficult to dose, can't be dose adjusted once they're in, and they really, really want to extrude, which is doctor talk for they want to pop out after they've been put in. I never used to like topical testosterone, but I really do now for the right patient. Topical compounded testosterone, not that icky gel stuff that you get from Walmart, is dosed once or twice daily. I'm really bagging on Walmart these days. I gotta watch it. Kind of like how your testicles dosed your testosterone back in the day. You don't get big swings in blood levels with topical formulations. The only drawbacks are the potential for transference to your dog or your female partner, who may not want a beard, and the potential conversion to DHT or dihydrotestosterone. Back to the chart. DHT is a metabolite of testosterone. It is an extremely powerful anabolic hormone, somewhere between 5 and 10 times more potent than testosterone. Sounds great, right? Well, that part is good, but too much DHT can cause benign enlargement of the prostate and male pattern hair loss in genetically susceptible men. The most common way to dose testosterone is still in a once weekly injection given in a muscle, like your deltoid, your thigh, or your buttocks. Ouch. This method of delivery is perfectly safe, but we can make it better. A little known secret is that testosterone can be given in a teeny tiny insulin syringe style needle a few times a week, just right under the skin. Something called a subcutaneous injection. This gives us much more of a steady state level of testosterone and doesn't have nearly the same discomfort factor that intramuscular injections do. There are some tips and tricks to doing this, but it has become my preferred way to go. Is testosterone bioidentical? Great question. When we're talking about women's hormone replacement options, there are fake hormones and bioidentical hormones. When we're looking at testosterone replacement therapy, things are a little different. They don't make fake testosterone per se. They make something called esterified testosterone. They stick an ester group on the end of the testosterone molecule that the body needs to cut off before the testosterone can bind to its receptor. The kind of ester group that they use determines its half-life, or the length of time it's in circulation. Half-life chart of testosterone esters, otherwise known as how long it takes for half of it to be gone. Testosterone cypionate, 8 days. Testosterone propionate, 19 hours. Testosterone enanthate, 4.5 days. Testosterone undecanoate, 21 to 34 days, depending on the carrier oil that they use. Using a testosterone ester with a longer half-life is convenient because it allows for less frequent dosing and provides a steadier state of hormone. I exclusively use testosterone cypionate for this reason. In theory, testosterone undecanoate would be preferable because of its extremely long half-life, 3.5 weeks versus 8 days. The problem with dosing testosterone only once every 3 months is that we get a great big peak in testosterone level, followed by a prolonged roller coaster ride down. Guys don't like this. There's too much shifting around of hormones on the top end and too much return of all the low T symptoms on the bottom. The other major issue is that the brand name form of testosterone undecanoate here in the US, Aved, comes with a black box warning that it might cause an oil embolism or anaphylaxis following injection because of the chemical particulates that they put in the formulation, which is used to extend its half-life. Because of this, Aved injections are always given in a doctor's office, next to a crash cart. Okay, so we've established that testosterone does a bunch of things. Improves strength, stamina, cognition, mood, erectile, and cardiovascular function. Testosterone also increases red blood cell count, can convert to estrogen and can also convert to DHT. It does this whether your body is making it or whether you're on therapeutic testosterone replacement. Functioning testicles make testosterone in a slow drip type of fashion. They make more in the morning, less in the evening, but it's a slow drip situation. When you're taking therapeutic testosterone, you're getting a bolus, more so if you're injecting once a week, less so if you're using a low dose cream twice a day. But either way, you're turning the faucet on full blast for a brief period of time. The two most objective measures of this are an increase in red blood cell count and an increase in estrogen production. We used to think that both of these changes needed to be medically managed. All men on TRT were automatically put on estrogen blockers, and all men on TRT were treated with something called therapeutic phlebotomy, an age-old practice that once used leeches to drain the blood of men for the healing of hypertension, varicose veins, and hemorrhoids. The thinking behind these practices was based on the following. Elevated hemoglobin or red blood cell counts increase the risk for blood clots, strokes, and heart attacks. This correlation is true when looking at men already at risk for embolic events. Men who smoke, have COPD, or a genetic condition called polycythemia vera have higher red blood counts because of a relative lack of oxygen or due to their underlying disease. They also, in fact, have higher incidences of blood clotting. This is called the third variable problem, not the three-body problem, but you should totally see that series if you haven't seen it yet. So good. Third sun out today? What's going on? Vampire Diaries. Is the increase in blood clots related to the elevated red blood count in these men, or is it related to their COPD, smoking status, or polycythemia vera? This should be an extremely nuanced discussion because just phlebotomizing men because their hemoglobin levels cross the upper limit of the reference range is careless and not without risk. Let me just make a few points here after I fix the light. 1. Men who smoke or have underlying medical conditions increasing their risk for clotting should be mindful of their red blood counts if they are on TRT. A topical formulation may be preferred. If phlebotomy is deemed necessary, ferritin or iron levels should be closely monitored and replaced because symptoms of iron deficiency look strangely like symptoms of low T. 2. Polycythemia vera or P. vera and secondary erythrocytosis from TRT are not the same thing. P. vera is a genetic condition that causes an elevation in all the blood cell lines: white blood count, red blood count, and platelets. Secondary erythrocytosis from TRT has been mistakenly extrapolated to P. vera. Many physicians are of the belief that if P. vera increases clotting risk, then just elevated red cell counts must also increase clot risk. This is false. 3. Populations of people who live at high altitude all have higher red blood counts because of the lower oxygen content in the atmosphere there. Athletes actually train at altitude to intentionally raise their red blood counts because it gives them an athletic advantage. The Olympic Training Center is in Colorado. Colorado has the 8th lowest mortality rate, the 3rd lowest cardiovascular rate in the US, and the longest life expectancy in the country, despite having the highest average altitude and highest hemoglobin rates. They're not all having blood clots, and we don't phlebotomize them. TRT is not a one-size-fits-all. What is in medicine? Working with an experienced provider well-versed in the nuances of how therapeutic testosterone replacement affects all systems of the body is key, including management of red blood count levels. To block estrogen or not to block estrogen? That is the question. Here's another relic of the olden days of TRT. Here's your testosterone, here's your estrogen blocker, and we'll see you every 3 months for your bloodletting. Medicine is just more complicated than that. Let's briefly go back to the hormone synthesis pathway for a second. DHEA is a hop, skip, and a jump away from testosterone. Estrogen, however, is a straight drive down. If you take therapeutic testosterone supplementation, you are going to increase estrogen production. More so if you give yourself a big bolus once a week, less so if you dose smaller amounts more frequently. We used to block this conversion of testosterone to estrogen. The big concerns from men were fluid retention, mood changes, and man boobs. For all the transgendered patients I have ever had in practice, I wish estrogen therapy alone would have caused breast development. It would have been so much easier. Problem is, it doesn't. Genetic predisposition plus hormone therapy equals breast development. Whether you subscribe to estrogen-causing man boobs or not, excess estrogen levels in men can be problematic, a topic for a whole other post. Want to keep estrogen production in check? Don't be a metabolic dumpster fire. Stop eating sugar. Stop eating 6 meals a day. Stop eating foods you can't pronounce the ingredients of. Go for a walk. Learn to be better at managing your stress. And no, alcohol doesn't count as stress management. If you were genetically destined to develop gynecomastia, or man boobs, and it is painful or makes you uncomfortable, please message me and I will connect you with a plastic surgeon who can help. Gynecomastia isn't necessarily a cosmetic issue. It can be painful and problematic. Not all plastic surgeons are schooled in dealing with this condition, so it's important to shop around. For better or for worse, surgery is the only definitive management for gynecomastia. Other common questions. Can I use just a low dose of TRT? Answer: no. When we give testosterone, the system says, hey, looks like there's plenty of testosterone around. So your usual testosterone producing system goes on vacation. What happens if you stop TRT or run out of your prescription? It takes a month or so, but your testosterone producing system kicks back in and starts making the same amount of testosterone it was making before. So when we're replacing low T, we give all of it or none of it. The dose is individualized to every patient, but we never go halvesies. Question: can I maintain fertility on TRT? Answer: no. The same signal the brain sends to the testicles to make testosterone is the signal that tells them to make sperm. When you're on TRT, you're not making your own testosterone and you're not making your usual number of swimmers. When men on TRT decide another baby is in their future, they need to come off their testosterone. We typically give the system a little kick to get it rolling again. This is where clomiphene or N-clomiphene are probably most useful. Having said that, just like putting women on birth control can affect their long-term fertility, putting men on TRT can in theory do the same. I personally have never seen that happen, but it's not a bad idea to go into TRT with the presumption that your baby-making years are behind you. Busting myths about TRT. TRT causes prostate cancer. No, absolutely not. I know I'm already way over on time here, and debunking this myth requires a post all on its own. This review article from the Journal of Urology in 2012 states, quote, our review of current clinical information revealed that to date, no study or review has definitively shown that androgen replacement therapy is an independent risk factor for development of prostate cancer. The contrary does seem to be true, however. Many studies actually link low testosterone levels to higher rates of prostate cancer incidence and aggressiveness of prostate cancers. Here's where it gets a little confusing, however. If a man develops prostate cancer, there is a relationship between testosterone and prostate cancer as explained by the saturation theory. This was a model put forth by prominent researchers in the field, Huggins and Hodges. The saturation theory in prostate cancer refers to the concept that prostate cancer growth is dependent on androgens, including testosterone, but only at low levels, specifically testosterone levels between 0 and 250 nanograms per deciliter. Once testosterone levels are 250 nanograms per deciliter or higher, the prostate is effectively saturated. Further increases in testosterone levels do not stimulate tumor growth. This is why androgen deprivation therapy can be effective, albeit absolutely miserable, for some men with prostate cancer because testosterone levels are driven down to castrate levels. Mean 0. Testosterone is just for bodybuilders. What? only bodybuilders get fat, exhausted, foggy-brained, and insulin-resistant? That's stupid. Next question. Once you start testosterone, you can't stop it. No. You can stop TRT anytime you'd like. However, your testicles will go back to making the same shitty amount of testosterone they were making before. Testosterone isn't fixing your testicles, it is replacing hormones lost due to age and lifestyle factors. Remember, up until 200 years ago, no one lived this long. 18th century dudes weren't injecting themselves with testosterone in their 50s because they were dead from tuberculosis at 35. Conclusion. Reclaim your edge with testosterone optimization. Low testosterone is not just a biological footnote. It's a slow, steady, life-altering hormone crash that can rob you of your energy, confidence, and vitality. The empowering truth is you don't have to settle for a diminished version of yourself. With the right approach, you can reclaim your edge. Testosterone optimization is not a one-size-fits-all solution. It requires a comprehensive approach that includes lifestyle changes, accurate lab testing, and, when appropriate, testosterone replacement therapy. It's about more than numbers on a lab report. It's about how you feel. If you're experiencing symptoms of low T, don't ignore them. You're not being a martyr. You're just increasing your risk of cancer, heart disease, and dementia. Functional medicine offers safe, effective solutions that can help you regain your strength, stamina, and clarity. But remember, TRT isn't a magic bullet. It works best when paired with healthy habits, clean eating, regular exercise, stress management, and quality sleep. You owe it to yourself and the people who count on you to invest in your health. Because when your testosterone is optimized, you're not just surviving, you're thriving. Whether it's feeling sharper at work, stronger in the gym, or more connected in your relationships, the benefits of balanced hormones will positively impact every part of your life. So if you're ready to get off the sidelines and back in the game, then let's get to work. Your best days are ahead of you. That's going to do it for me. Thanks for hanging in there until the end. I know that this was a long one. If you found this information useful, please like the post, subscribe to the channel, and share it with a friend. You know that friend who needs to hear this. Stay informed, my friends, be empowered, and know that you are in charge of your own healthcare. Take care. I'll see you for the next one. Bye for now.